And this afternoon, health officials are warning of a possible health emergency in the Yilo and Lower Manya municipalities if steps are not taken immediately to restore electricity supply to the area. For close to a week now, residents have been without power supply, raising concerns over security and the negative effects on daily life. As we speak, final year students preparing to sit the basic and senior high school final examinations have had a hard time taking some revisions ahead of that paper. Joy News' Manuel Cranting was in the area yesterday and comes through with this report.
It's been all sorts of, just endure around us. Really, we've seen some of the residents here move about, attempting to access the main community where they have, conference facilities, where they have hotels, churches, and so on and so forth. These facilities actually have standby generators, and so what we're seeing is some of them now trekking just along the road to access the main community. But as I've been speaking to a few of them just before you came to us here, Ernest, many of them have had, their consumables and perishables just go bad. Their gadgets are spoiling also. And really, it's a hard-hitting situation for their businesses. And as you'd imagine, a lot of the economic activities that are carried out within the community here in Somanya, and it's of course adjoining communities, are heavily dependent on electricity power. For 5 days now, many of the people here have not been able to go to work. When they go to work, they wait the entire day for small-scale businesses like barbering shops, like hairdressers, salons, and so on and so forth. All of these ones have not been able to properly work because beside the fact that the lights have been out for about 5 days, they also are unable to afford standby generators. We're told that a few of the people, and indeed hotels and so on that are around here that are able to afford these standby generators, the cost incurred in just the past 5 days is almost unbearable. We'll just try and speak to a few of the people who, just as we began talking here, I began, just gathering around here, giving you an indication of how interested they are in the situation. Babas, good evening. Thank you for speaking to us here on the Joy News channel. Tell us your name and what you do here.
Good evening. My name is Ocho John Sebastian. Okay. I'm a health worker. I work at Takuse, but I reside in this community. And the effects of the light out is in fact a very big issue we need to talk about. I would say it's a public health issue because looking at the health service, the blood we have in the bank, the vaccines we have, and how we're going to administer and all that is going to cause a lot of how do I put it, generators, the fueling and all that, management of the various hospitals.
I'm carrying a lot of costs to keep these generators running. But you live here also.
Yes.
How has this been affecting you?
Yeah, for some time now we hardly iron our dresses. You go to where they have generators, sometimes you pay something little before you can iron. This is affecting all of us. Some of the things you even eat, our fridges are off. The foodstuffs we have in the fridges are all rotten. And in fact, the impact is not just the social aspect, but also a public health. Like I said, some of the things they have, you meet people selling, how do you call it, Indomie and all that. Those cabbages, how are they stored before they even bring them out to even prepare the Indomies that we are taking? So to me, I am taking it from the public health perspective. So it is affecting us. Now, as we are saying, what is happening in the environments where there are no lights is also something we need to look out for. And so the absence of the electricity in the community is indeed not affecting individuals, but also affecting the health, affecting our health issues and the social aspect.
Thank you. So he's just talking to us about the public health implication of having these gadgets and all not functioning. But you're also here. What's your name, sir?
Yes, my name is Abuaji Edmond.
Abuaji Edmond, you've also been going through the same situation. How has it been affecting you?
Yes, it's very terrible. I live just around the Mount Mary Training College, and the lights off is not just affecting us individually, but then the public institutions as well. If you see the number of students who have to trek from the school, go out, even the security, their safety, it's serious. What we are going through is not a child's play. Whoever is in charge must make sure that power is restored to the good people of this place, so that whatever the issues are, we don't care about whether people say they will pay light bill or not. Some of us are ready to pay. We are paying. Some of us have even accepted or embraced the prepaid meters. So whatever the issues are, we are not concerned. We are focused on how we can build our businesses and how we can be free from this darkness. If I tell you the impact on businesses, my brother, you will marvel. You will marvel. It is not good. Some of the ECG cables are even being stolen because the people know that the lights are off now.
And we can just see right here,
yes,
some of the cables hanging, yes, right beside the pole, giving you an indication of what, exemplifying what he's been telling us. But as we talk, we've seen a storm here which seems to have electricity connection. But just as I get closer, I'm hearing the sound of a generator just blaring right here on the street. And so, in fact, we've been driving for close to 20 minutes on this particular avenue here in Somanya, and we're told that nobody, or if you like, no household actually has connection to electricity. So just across this part, we're seeing the stores. Just one store out of so many that are lined up on this particular stretch of the road has electricity tonight, and we're seeing that people are just coming around and attempting to access the electricity. Well, they're standing there and watching us even as we do this. And as we're getting closer, Ernest, it is becoming more and more clear that they are indeed using a standby generator. My boss, good evening. I'm sorry to be intruding on you like this. My name is Manuel Cranton with Joy News. You're live on the Joy News channel. That's a standby generator, confirm?
Yeah, it's true. We have to use generator to charge our phones.
So this is a place you charge mobile phones?
Normally, it's not a place that we charge mobile phone, but then we are taking advantage of the light out over here to do business for ourselves.
I see. So almost everybody in the town comes here to charge their phone.
Not everybody. Those in this vicinity actually visit here. Other places too, there are generators who are charging phones for other people.
Well, so my colleague Manuel Cranting painting that picture to us of how dire the situation is. In fact, Joy News is learning this afternoon that the effects of the power cut is beginning to bite hard, as almost all public health facilities in the area are struggling to keep up with operational costs. Also, what's more triggering is that the ongoing COVID-19 vaccination is on the brink. Let's bring you excerpts of that notice we're getting from the Municipal Health Service right here, indicating that the Municipal Health Directorate spends about 1,500 Ghana cedis on a daily basis just to ensure that the vaccines are kept under appropriate cold chain management. Now, similarly, as we're seeing from this notice, all vaccines from affected health centers, some of which have been affected, have been relocated and brought to the Municipal Health Directorate cold room. And that facility, as we understand, is providing some sort of temporary shelter, if we could use that word, for the vaccine so they don't go bad. But beyond that as well, we know that there's a lot more happening in the area. And one of them has also got to do with the amount that is being spent on a daily basis by some other health facilities in the area. So we'll bring that to you shortly, telling you what more we know about that. So let's move on. We know that as a result of the power outage, the municipal cold chain equipment, which is the vaccine, the fridges, the equipment, has been relocated to one of the chip compounds within the municipality so that all of these vaccines can be kept there. Therefore, on a daily basis, as we're learning from this notice, the municipal EPA coordinator has to visit the health facility between 3 to 5 times which is resulting in some additional fuel expenditure. We understand that is costing somewhere around 250 Ghana cedis on a daily basis to power generators to run that office equipment. And so in all, and you see that in the next slide, as we'll point out to you, that the equipment are almost getting damaged, and that the notice from the Municipal Health Directorate is that all of the something needs to be done. So we'll point that out to you. We know that ongoing COVID-19 vaccinations is also being affected, as I was pointing out, as a result of the situation. The vaccination teams, the district and sub-district supervisors are also not able to charge their devices, because when you do the vaccination, you need to put in the data into the machines that are being used. So that's the latest that we're getting from the Yilo and Lower Manya municipalities. So fortunately, we do have the regional minister joining us via Zoom, Honorable Seth A. Champong. He will give us some updates as to what it is that his outfit has been doing. We understand that some engagement started earlier today with community leadership and some other stakeholders. Thank you so much, sir, for your time here on The Pulse. So what more can you tell us about what it is that you have done so far in resolving this crisis?
Thank you very much. Good afternoon. Like you're very much aware with your report so far, it is a major worry for us at the Regional Security Council, where we have received repetitive reports from the MUSECs of both municipalities, i.e. the Lower Manya municipality and the Yilo Krobo municipality. What it is residents are very much worried because the darkness wasn't envisaged and it is falling on them. But we need to discuss this matter holistically. I must say that the actions of some residents in this area, particularly Lower Manya Krobo, is really hurting the entire enclave. Let me be very blunt here. You would recount that for close to 8 years now, nobody in that enclave has paid any amount of money to the Electricity Company of Ghana, i.e. since 2014. Reasons are that some installed meters at the time, in 2014, started generating some outrageous bills, so they call it overbilling. And the community had a lot of issues to deal with that. As a result of that, the supplier and the service provider, which is ECG, in its own wisdom, decided that they will, starting from this year, that is last month, replace all those postpaid meters that were generating those faulty reports and replace them with new prepaid meters, which is a national policy going across the length and breadth of Ghana. Now, this decision by the supplier, that's the service provider, to the community has generated a lot of concern for us in respect of public safety, community unrest. But let me just do a quick review of where we have touched. Some members of the community have accepted these prepaid meters, and I'll give you a quick rundown of those areas. In particular, in Lower Manya, areas like Lolonyo, Belikope, Batokoji, Pon Cortes, and even Pon Zongo, Krobo State area, Abusunya Kope, and part of Nwasu Newtown. These are all communities in Lower Manya. They have allowed ECG to replace the meters. Our biggest challenge has been when they got to neighborhoods like Bow, and then people picked up arms. We have had opportunity to give them the room. They wanted to demonstrate that the national security, bringing in men from the 48th Regiment. And these are technicians who have knowledge and skill in mounting meters. It came as a result of the series of threats the service provider had received from some residents. That is the reason why these people went there. And it's been very smooth until they got to neighborhoods like Ponu, and we started experiencing these issues.
And I mean, all of the background you're laying to this now,
really,
the background you're laying to this now is very much appreciated. But I guess for residents in the area, and you are an authority, so you'd be able to tell, the anxieties about when the power cards will be reversed and when light will be finally back on within the community. Are you able to say on authority when that will happen? It appears we're having some challenges to the connection there. But earlier, as we were pointing out, some issues with even the vaccination going on there. Irina Ofei is the Municipal Health Director in the Lower Manya area. Thank you so much for your time. So you have been trying to paint the picture about how dire the situation is when it comes to the health sector and some possible implications for public health. What more measures are you putting in place to avert all of these challenges that you're pointing out to?
Yes, good afternoon. And once again, thank you for the opportunity to speak to the issue at hand, to the power outage in Yilo, Krobo, and Lower Manya Krobo municipalities in the affected areas. Point of correction, I think in your earlier submission, I heard the presenter mentioning some of the EPI equipment getting damaged. The equipment is not damaged. We put measures in place to ensure that since last week, Thursday, all the EPI fridges, the fridges where we keep the vaccines, are kept properly. So in Lower Manya Krobo, all the vaccines from the health centers, they have been brought to the Municipal Health Directorate, to their cold room, and the vaccines are kept there. For that matter, generator is run to maintain the temperature in the vaccine fridges.
Okay, so given the memo that we've seen that you've issued to the Regional Health Directorate,
yes,
what exactly are you demanding? What's the request, really, to deal with the challenge?
You see, when we have a power outage for 6 hours or 12 hours, we can run generators to support the service. But when you have the power outage for 6 days, today is exactly 6 days, tomorrow will be exactly 1 week, running of generators by various health facilities and various health directorates becomes very costly. In our joint statement with my colleague from Lower Manya Krobo, we have mentioned the amounts on daily basis the facilities are spending. For example, St. Martin's de Porres Hospital, they spend close to 5,000 to run the generator to power the full facility 24/7. At Tua Government Hospital, they use 3,000 to run the generator to power the health services. For Yilo Krobo District Hospital, it is a new facility. We started operating on the 21st of April 2022, just this year. So for them, they don't even have a capital to use 3,000 a day to run the generator to power all the equipment in the facility. So they have to do the rationing. So if they are powering maybe laboratory services to run the labs for the clients.
All right then.
Yes, unfortunately for Somanya Polyclinic, they don't even have a generator set. So they have to hire on daily basis, pay hiring fee, and at the same time buy the fuel into generators.
Right,
so the running cost of generators for a week is having a toll on financial toll on our health facilities.
And Irina, how soon do you want the lights back on?
Immediately. As soon as possible, because we have been in the darkness for the past 6 days. I don't know if any citizen in the country has experienced such power outage as Yilo Krobo and Lower Manya Krobo are experiencing. And you see, health services, we provide health services 24/7. The barbering shop you can open in the morning, close in the evening, isn't it? But people fall sick 24/7. Someone who falls sick in the morning, there will be emergency at night, and people need to be rushed, and we need to provide services. We need to maintain our blood banks. We need to do a lot of things. We have to provide quality health services to our clients, but unfortunately, the cost that we are incurring, our facilities are incurring, is very high.
Okay,
so we
then.
want the power restored immediately. And we are appealing to the government, we are appealing to ECG to consider the health service provision in these areas. Because I don't want anyone who would like to hear that as a result of this power outage, somebody's life was lost, isn't it?
Right. Irina Ofe is Municipal Health Director, obviously anxious and waiting just for the lights to be brought back on. Fortunately, let's try and get some answers for you once more. The regional minister said the Champo is back on. Mr. Champo, you were talking earlier about the background. I was just asking if you're able to tell us on authority when the lights will be back on.
We were in serious discussions with the service provider and the sector. So this morning, some meetings have happened. We're also holding dialogues in the community with some community leaders so we can all go and demonstrate some remorse to the service provider, because I must be very blunt here. Our actions have brought the entire community into this worry. Some residents, the reasons are that most residents in the communities I mentioned have taken the prepaid meters. We are looking to solutions for us. Where can we in this republic say that for 8 years, nobody is paying for services being provided for? Who will cater for us in this society? We do so by ourselves. You listen to your earlier contributors. I was watching. Some are saying they are ready. And this is not only in Lower Manya, it is in both. ULO is accepting. The entirety of ULO wrote to me in my office that they are not against the service provider in bringing the prepaid meters to them. So I don't know why the others are playing this with us. As we speak, I have asked that the service provider assist us with some emergency supplies to the public essential installations, like the municipal district, the municipal hospital, where Irina is discussing. This is on borders on the state security, and this is one of the things we are worried about.
But then we know that there's the concern about overbilling, which the residents have spoken about. Have you been able to, reconcile the data and rectify the issues?
We do.
I was just asking about the issue of overbilling. Have you been able to rectify the issues and reconcile the data? Because that's part of the demands of the residents as well. Well, it appears that obviously you can understand what the situation is in parts of the eastern region. We'll try and definitely get back the regional minister for you. But let's take you back to the eastern region. The regional minister said a champion is back this time round on phone to provide some clarity on the matters, the situation where the residents of Yilo and Lower Manyakrobo have been without light since last week. Honorable Minister, you were just talking about the fact that you are still in talks with some of the service providers to bring the lights back on. But I was asking about the concern on overbilling. The residents say it's part of the reasons why they are not willing to pay. Have you rectified the issues and reconciled the data?
To be blunt again, the resolution of the overbilling matter, it is the magnanimity demonstrated by the service provider that he is withdrawing all those faulty meters and replacing them with fresh prepaid meters. That is the solution. There is no other way that the service provider, by virtue of technical arrangement, this is engineering, if a device is providing wrong data, wrong readings, we have to introduce a device that will give us good readings. Bottom line, the foundational concern here is that overbilling is as a result of wrong readings. So you have to change that device. And the only way we change that device is the deployment, which is ongoing, that some residents are battling the service provider and the stewards over. The only way we can bring a finality to this conversation is to allow the prepaid meters to be established. And like I said, since 2014, no single payment has been made to the service provider. If the entire country begins to go this way, where would we be? This is my worry.
But what's the difficulty?
When we go begging the service provider, for instance, as I sit here as a chairperson to the Regional Security Council, what are my worries? My worries are providing over and above security for state installation. Because information we are picking from the ground points to the fact that people may vandalize state property. It has happened in the neighborhood before. In times past, the service providers' customer service center was vandalized. And then they had to relocate the service customer center to the voting region, which is Strapon. So we had to sit to the service provider and encourage them. This is the reasons why we find the security personnel aiding the service provider to install the prepaid meter. Even in this era, people are still pelting them with stones. And when people have been officially and professionally disconnected, they go back onto the line and reconnect themselves to the service, which is an affront to the agreement between the customer and the service provider. These are matters that are brought to the Regional Security Council's desk. And so when you are evaluating this conversation, you don't just be one-sided and be only socially led, that your people are in darkness, and so as a result of that, restore power for us. Like I said in my earlier contribution, discussions are very far advanced to provide for the essential services. We know our children are going to write examinations in the next few days. Some are there, the children's preparation. So the Ghana Education Service, we are providing power for them, emergency. We are going to provide power for the health facilities, which we heard Irana speak so passionately about. I was so much sad listening to her. But this is as a result of our own actions and inactions, which is bringing the community this way. We have offered the community every civil opportunity. You want to demonstrate? We bring men. We go and plead with the IGP. He supplies us men to come to the community to demonstrate, write to us what your issues, what your concerns are. We give all these liberties enshrined in the Bill of Rights, our Constitution. We do all these things because that is the only way the governed and the governing can engage.
But by the way, what's the difficulty? But what's the difficulty in simply writing off the debt and starting everybody on a clean slate, so that at least all of these issues will be dealt with?
So beautiful. That is why the discussions are ongoing. But you see, if we are writing all debts off, that is not the only area the service provider is engaging people and discussing people on debt. If you give such an amnesty just by word of mouth, everybody will run to the service provider that, please, you granted this amnesty.
So what do you... Yeah.
And if you may allow me to proceed, I beg your pardon.
Right.
Discussions are very much going, and it is pointing to that direction. And this, they are even admitting that even beyond that, they'll still find ways and means of offering moratorium for people to defray where there is some debt to be remained. So it is a very, very, for me, cordial engagement that we should all bring cool heads to the table and move on. Months on end. It is not just this past July. Since this exercise, before I have been here, we've had issues on electricity. I've gone in community.
Well, anyway, that's quite a bit of a challenge now, but we'll definitely try and reconnect some other time with the regional minister. But for now, the message is clear. Government is giving indications that the lights will be restored, but that would have to happen on a number of conditions. Seth Champong is the Eastern Regional Minister. But